Hey everyone, welcome back to Knowledge Park. Today we're talking about sexual health. It affects millions of men, but many don't feel comfortable talking about it. We'll look at 3 common issues: erection problems, often called erectile dysfunction, low desire, and performance anxiety. If you've struggled with performance, felt less desire, or got stuck in your head during an intimate moment, you are not alone. More than 1 in 3 men face one of these at some point in life. Here's the key thing: this is common, it's treatable, and it isn't a sign of weakness. Today we'll explain the causes, bust the myths, and give you clear steps you can use. Let's begin. To see what can go wrong, first know how it works. An erection isn't an on-off switch. Desire starts in the brain. Hormones like testosterone support it, nerves carry signals, and relaxed blood vessels let blood in and keep it there, mind and body working together. Erectile dysfunction means persistent trouble getting or keeping an erection firm enough for sex. An occasional off night is normal. Causes fall into 2 groups. Physical: poor blood flow, nerve injury or neuropathy, diabetes, cardiovascular disease, treatment side effects, smoking, and heavy alcohol use. Psychological: stress, performance anxiety, depression, and relationship strain. A doctor can sort this out with your history, a simple exam, and blood tests, typically testosterone, blood sugar or glucose, and cholesterol or lipids. It's routine, private, and designed to match treatment to the cause. Let's talk about low libido, the level of interest in sex. It's different from erectile dysfunction. You can want sex and still have erection trouble, or have low desire and normal erections. Both are common, treatable, and nothing to be ashamed of. Common causes include low testosterone, ongoing stress, poor sleep, depression, side effects from some therapies, relationship tension or low emotional closeness, heavy alcohol or drug use, and chronic illness or pain. Performance anxiety is different. Pressure leads to stress and adrenaline. Blood vessels tighten, erections get harder, fear grows, and the loop repeats. Triggers include a new relationship, past awkward moments, body image worries, porn comparisons, fatigue, alcohol, or certain treatments. You're not broken. This is manageable. Here's what helps. Use a 3-part plan: medical options, lifestyle changes, and therapy with communication. This combo treats causes and calms anxiety, so you can feel confident again. Medical options: a doctor can tailor care to you, improve blood flow when appropriate, address hormones, and treat conditions like diabetes, high blood pressure, or heart disease. Review all current treatments and therapies that could affect erections and make the decision together. Specific options include vacuum devices, in-clinic therapies when appropriate, cognitive behavioral therapy or couples therapy, pelvic floor training, and treating sleep apnea. Choose with your doctor. Lifestyle changes: move most days. Cardio supports blood flow. Build meals around vegetables, fruits, whole grains, beans, olive oil, nuts, and fish. Limit processed meats and sugary refined foods. Stop smoking. Keep alcohol modest. Sleep 7 to 9 hours. Manage weight, blood pressure, and blood sugar. These habits protect heart and nerve health, the same systems erections rely on. Small steps, repeated, work better than crash fixes. Therapy and communication. Cognitive behavioral therapy breaks the anxiety loop. Use consent as your compass. Check in, ask and listen. Warm up with slow foreplay, touch, massage and eye contact. Use a water-based lube to reduce friction. Choose relaxed positions like side lying or woman on top. Breathe together, go slower, and talk about what feels good. Myth: erectile dysfunction, or ED, only happens to older men. Fact: It can affect any age. Stress, lifestyle, and health play big roles. Myth: one bad night means you have erectile dysfunction. Fact: occasional difficulty is normal. ED is a persistent pattern. Myth: one quick fix solves everything. Fact: best results come from personalized multimodal care. Health, hormones, and anxiety addressed together. Home support: you can try. Set the scene with dim lights, a warm shower, and soft music. Shift into a gentle, curious mindset. No scorekeeping. Use slow, full-body touch without goals. Relax first. Practice 4-7-8 breathing together. Add light pelvic floor squeezes. Engage, then fully relax. Try a 1-minute mindfulness check-in. Take breaks, laugh if it helps, and keep talking. Keep it playful and pressure-free. The goal is comfort and connection. Progress builds session by session. Important: always talk to a doctor before using any over-the-counter products or remedies. They can interact with your health or other treatments. Safety: some sexual function treatments can dangerously interact with certain heart prescriptions, causing low blood pressure. Always tell your doctor about every heart treatment before starting any sexual health therapy. When to see a doctor: book a visit if it's lasted over 3 months, there's a sudden drop in desire or erection quality, you notice other symptoms like fatigue, mood swings, or pain, or it's causing you or your relationship real stress. No shame. Doctors see this every day. If you're unsure, a quick consult can rule out medical causes and give you clear next steps. Red flags: get emergency help now. Chest pain during sex, fainting, severe shortness of breath, an erection over 4 hours, or sudden weakness, trouble speaking, or vision loss. See a doctor soon if you have diabetes, high blood pressure, high cholesterol, sleep apnea, severe depression, or use performance-enhancing substances. Erectile dysfunction can be an early heart warning. At-home checklist: track symptoms and morning erections. Review your current health with your doctor. Cut back on pornography. Sleep 7 to 9 hours. Exercise 150 minutes weekly. Stop smoking. Limit alcohol. Manage stress with the 4-7-8 breathing technique. Helpful resources: urologist directories, certified sex therapists, and sleep apnea screening. This video is educational and not medical advice. Speak with a qualified professional for personalized care. Which medical departments help? Start with primary care or general practice. Specialists may include urology, endocrinology, cardiology, mental health professionals such as psychiatry and psychology, or certified sex therapy, sleep medicine, and pelvic floor physical therapy. Your doctor can coordinate referrals. Quick practice: inhale through your nose for 4. Hold for 7. Exhale gently for 8, like a slow sigh. Let your shoulders drop. Good. Notice the calm. Prevention recap: regular checkups, daily movement, balanced meals, and solid sleep. Manage stress with simple breathing. Limit alcohol, avoid smoking, and talk openly with your partner. Small habits, repeated, protect long-term sexual health. To keep this video short and focused at 10 minutes, we'll save the advanced psychology tips for our next video. In that one, you'll learn one simple sentence that quickly calms performance anxiety, and a 3-step method to retrain your mind for lasting change. Subscribe so you don't miss it. If this helped, please like and share. Subscribe for clear evidence-based guidance. You've got this.